Hello, my name is Destiny and today I'm going to be demonstrating an abdominal aortic aneurysm. For demonstration purposes, we are going to be using our patient here named Lamb Chop. So, what supplies am I going to be using for this demonstration? Alright, materials needed are going to be a stuffed animal or willing participant. You are going to need some suction tubing, which is going to be your aorta, a bulb and bulb connector from a blood pressure cuff. This is going to create the inflation. You are also going to need electrical tape to reinforce on either ends of the suction tube. The balloon is what's going to be the aneurysm. So all those materials together, we are going to put the balloon on one end and reinforce that with electrical tape. This is going to prevent air from leaking out. Okay, the other end of it, we are going to take the bulb from the blood pressure cuff and we are going to connect that to the end of the suction tube, reinforcing that with electrical tape as well. So, before we get into the demonstration, I need to tell you a little bit about our patient, Lamb Chop here. Lamb Chop is a 66-year-old male who was a smoker for 30 plus years. So, due to his age, his blood vessels have naturally become less elastic, so they became more prone to damage. After having years of exposure to smoking, this also started taking a toll on his body. So, what is AAA? AAA is abdominal aortic aneurysm, which is a bulge or enlargement in the aorta. If we remember, the aorta is the main artery that carries blood from the heart to the rest of the body. So what I'm going to do with our patient Lamb Chop here is I'm going to take the end with the balloon, and thankfully he already has an incision here. So I'm going to take that and put that in here and push that down to his abdominal area, which is not very far because he's a small guy. And then I am going to start inflating. And that is the aneurysm that this man is experiencing after having 30 plus years of smoking. Okay, so the bulge. So he has this bulge. That is what's going on here. It's an enlargement. Okay, so what is happening to cause this bulge? This bulge is happening because the wall of the artery has become weak. Blood flowing through the artery pushes on the weak spot, causing it to stretch and balloon out. That is what causes creates the aneurysm. If it gets too big or burst, it can be life-threatening. So, what are some possible causes? Well, we know his age and smoking were some causes, or rather risk factors, because the exact cause is unknown, but several factors can increase the risk. Age, smoking, high blood pressure, high cholesterol, diabetes, family history, as well as certain genetic disorders. So how do we treat that? Well, really depends on the size and whether it's asymptomatic or symptomatic. Small, asymptomatic AAA may be monitored regularly with imaging tests. Larger and symptomatic AAA may require treatment to prevent rupture. Two types of treatments for that would be endovascular repair and open surgery. Endovascular repair is where they put a stent into the aneurysm to reinforce the weakened artery. Open surgery is where they put a synthetic graft in the affected section of the aorta. So, as a CNA, what is your role? How does it help you to have this knowledge? So, CNAs are often the first line of sight when minor subtle changes happen. So, observation, reporting, and basic basic patient care under the direction of the RN is the role of the CNA. So monitoring vital signs, observing for signs of decreased perfusion, which would be where you look at the hands and the feet. More specifically, you're going to be looking for clammy, pale, or cool skin. You're going to observe for signs of decreased urine output. You're going to report these changes immediately, but also assist with comfort and mobility. So, why is it beneficial to know this information as a CNA? It's going to allow the CNA to report subtle changes that could signal an emergency. Because again, CNAs are often first to notice critical changes due to the fact that CNAs provide the daily hands-on care. So, how does this topic benefit a student taking the CNA test? Well, the topic of AAA reinforces fundamental skills such as taking vital signs and observing changes in a patient's condition. AAA is often asymptomatic and can go unnoticed. All right, that is all I have. We are going to hope that Lamb Chop makes it. He has a lot of damage done to his body. So we'll see where it goes from there. Thanks for watching.